2 weeks after my double eyelid surgery, eyelids are still swelling, red, and itchy. Can I apply Tobradex? Can I apply Tobradex sterile ophthalmic ointment on affected areas?
Thank you for your question. You submitted 2 photos with your question, and you state that you have had Asian eyelid surgery done 2 weeks prior, and that currently you're concerned about itchiness, redness, and swelling, and you're asking if Tobradex can be used to help alleviate these symptoms. Well, I can certainly give you my opinion based on just the photos alone. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Asian eyelid surgery is a significant part of my practice. I treat patients from around the world for both first time having the surgery as well as revision surgeries for complications or undesirable results after Asian eyelid surgery. So I'll tell you first that the main person you should ask this question is your doctor. If you have been doing follow-ups with your doctor, then your doctor has naturally has an experience from practice as well as experience from treating you as to what looks right and what doesn't look right. And I'll explain further. Asian eyelid surgery is like other eyelid surgeries in some ways and very specific in other ways. What we're doing with Asian eyelid surgery is creating a connection between the skin and the muscle called the levator muscle, and that's to create the crease. Now, with Asian eyelid surgery, there is a natural progression where swelling can be significant from the incision or crease area as all the way to the margin, basically where typically someone would apply eyeshadow. Now that area can be swollen, and it can be normally swollen for several months after surgery. Then as far as redness and itching is concerned, 2 weeks after surgery, it's not unusual to have redness. But when it comes to the degree of itching, this is where we have to try to differentiate what the cause of the itching is. It's normal to have a certain amount of, let's say, low-grade itching and awareness that the skin is essentially healing. Now that's different from itching related to allergy, and that's what I want to try to differentiate. When I tell my patients to apply antibiotic ointment to the upper eyelids, I actually have them only do the antibiotic ointment for several days after surgery. I have them stop the antibiotic ointment after a few days because I have a concern about the development of something called contact dermatitis or an allergy to the antibiotic. Now, very often people think that when they have more, let's say, redness, which is a typical sign of contact dermatitis, they may think they're getting an infection. And so what do? They apply more antibiotic ointment. Unfortunately, that further aggravates the condition of contact dermatitis. So very often what I tell people is, or typically I'll say, after several days of antibiotic ointment, stop the antibiotic ointment, but to help the skin heal, which is optimal for a moist environment for skin to heal, I'll have them use something in the petrolatum family, such as Aquaphor. Now, it's very important that I also advise people to not use anything else. Very often, patients are eager to have their incisions heal well, and to avoid scarring. So they may find different remedies, over-the-counter skin treatments that are used to, quote, prevent scarring, and a lot of times those can be irritating. So I tell them, don't put anything other than Aquaphor. Beyond that, I would say that just by the photos alone, it's very difficult to tell whether you're having an allergy versus just normal itching. It's just part of the normal healing process to have some itching. Now, short-term symptomatic relief, there may be a role to use something with a topical steroid. But I think it's very important that you speak to your doctor about this, or better, see your doctor, because your doctor will be able to tell pretty quickly. Photos are helpful, but often photos are not as accurate as we would like them to be. There's sometimes the intensity of the colors and the details can be either exaggerated or not as well defined. So nothing beats a personal examination and evaluation. So to answer your question, it may be helpful to use Tobradex, but I would still be careful about whether or not that same Tobradex was used after the surgery and whether you might be causing more problems by continually using it. So again, meet with your doctor and discuss these concerns and issues. I have my patients after Asian eyelid surgery. I see them more frequently than I do non-Asian eyelid surgery in the first month. I'll see them at 1 week, then 2 weeks later, and then 2 weeks after that, just to watch them during this initial period where swelling can be concerning and the incision healing can be concerning. So I'd rather see them in person rather than just tell them to come back after a month. And that's just my personal approach. So I hope that was helpful. I wish you the best of luck. And thank you for your question.